Today we'll be discussing a disaster relief scenario and how the nurse would respond as it relates to a hurricane and vector-borne disease outbreaks. In this scenario, a hurricane has caused significant damage to the infrastructure, which includes healthcare systems, transportation, and access to clean water in a small island nation in South America. Many residents have been stranded and are unable to access timely care. The environmental conditions following the hurricane have also caused a lot of standing water and humidity, which created an ideal breeding conditions for mosquitoes. As a result, there's been an increase in vector-borne diseases such as malaria, Zika virus, and West Nile virus. Indigenous communities are experiencing a disproportionate impact due to pre-existing health disparities, limited access, and just general geographic isolation. With that scenario in mind, this is going to look at nursing priorities and client care. So as a disaster relief nurse, the first priority is always rapid triage and assessment. We're going to focus on our ABCs, so airway, breathing, and circulation, to help us identify life-threatening conditions. According to the World Health Organization, or the WHO, timely assessment and prioritization are essential components of an effective emergency response. The next piece is infection prevention. This is especially important in this environment where mosquito-borne illnesses are increasing due to that standing water. Nurses can help implement mosquito control strategies and reduce the exposure to prevent further disease in the community. Next is basic needs. So meeting basic needs such as access to clean water, food, and shelter is essential to support recovery and prevent further illness. It is also important to identify high-risk populations, including pregnant women, children, and older adults when we're considering basic needs, as these may be people that are more vulnerable to complications. Early recognition of symptoms such as fever, chills, or neurological changes will also allow for prompt intervention. Finally, the last piece is providing culturally appropriate patient education to ensure that prevention strategies are understood and respected, particularly in the Indigenous communities. This will help align with the public health principles of equitable and culturally sensitive care. Next is our roles in disaster management. As disaster relief nurses, care extends beyond that basic direct patient care. We're looking more at prevention, promotion, and population health. Collaboration with interdisciplinary teams, including physicians, public health officials, and humanitarian organizations, is also essential in this disaster management plan to ensure that care is organized and resources are distributed effectively. Education is another key responsibility of the nurse. Nurses will provide culturally appropriate teaching on mosquito prevention, hygiene, and recognizing those early symptoms of illness. This can help reduce transmission at the community level. Nurses also play an important and amazing role in disease surveillance by identifying patterns of illness and reporting cases to public health agencies. This allows for timely interventions to help control outbreaks. In addition, coordinating care and resources ensures that high-risk populations, such as the Indigenous community, receive that equitable access to services. Nurses may also assist with any evacuation efforts or support safe shelter environments that will help protect that vulnerable population and help to maintain a continuity of care. So overall, the nurse's role in this disaster management is both clinical care while also considering public health principles to improve outcomes for the individual and the community. Now we're going to go into the epidemiological profile. So after the hurricane, mosquito-borne diseases became a large public health concern due to environmental disruption. So we talked about how the flooding and heavy rainfall created those areas of standing water, whether it be in debris, containers, or just low-lying areas, which serves as an ideal breeding ground for mosquitoes. This leads to a rapid increase in mosquito population and a higher risk of disease transmission. Additionally, any damage to the infrastructure and that limited access to healthcare can increase vulnerability. So the three primary mosquito-borne diseases that are worth noting are malaria, Zika virus, and West Nile. Malaria is caused by Plasmodium parasites that present with symptoms like fever, chills, anemia, and it can potentially progress to life-threatening if untreated. Zika virus, while it's typically mild, can pose serious risks during pregnancy, including birth defects like microcephaly. And finally, West Nile. This is the most common mosquito-borne disease, and it can range from mild flu-like symptoms to severe neurological complications like meningitis or encephalitis. With this in mind, post-hurricane conditions like overcrowding shelters and disrupting vector control efforts increase those risks for all of these diseases. Environmental and climate-related changes, also associated with the extreme weather event, further influence the distribution of mosquitoes and how the disease spreads. So overall, hurricane conditions create the perfect area for mosquitoes to breed and increase human exposure, leading to a high risk of disease outbreak. Infected prevention can include mosquito control, public education, and access to healthcare services, which we're going to discuss a little bit more later. Okay, now going into population and impact. Indigenous communities, as we spoke of earlier, are especially vulnerable after disasters like a hurricane due to the long-standing health disparities and systemic inequities. Many Indigenous populations experience limited access to healthcare, high rates of chronic illness, geographic isolation, like in rural or reservation-based areas, and just that general socioeconomic decrease. So following a hurricane, these challenges are significantly intensified. Damage to the infrastructure can disrupt access to clean water, sanitation, electricity, and any already limited healthcare services. This increases their risk for infectious disease. Additionally, overcrowding in shelters and temporary housing can accelerate the spread of communicable diseases, and with limited access to preventative sources like hygiene and vector control, that further compounds the risk. From a nursing perspective, disaster response is often complicated by barriers like a lack of culturally competent care, a historic mistrust in the healthcare community or the system, and insufficient coordination of resources. So nurses play a critical role not only in providing that direct patient care, but in addressing broader public health needs and advocating for vulnerable populations like Indigenous. They also promote a culturally appropriate care and interventions. So as a result, Indigenous communities often experience worse health outcomes following disasters, like those already noted, higher rates of illness, delayed recovery, and reduced access to relief services. Disasters amplify existing social and health inequities, making it essential for healthcare professionals, especially nurses, to implement culturally sensitive disaster preparedness and response strategies. Okay, there are multiple levels of support during disaster response. The three main pillars is local, national, and global, and each level plays a unique but interconnected role in protecting public health and managing disease. At the local level, public health departments, community clinics, and hospitals are the first to respond. They provide that immediate medical care, distribute essential supplies like clean water, mosquito repellent, and they also conduct community outreach and education. Local agencies can also perform some disease surveillance and then report these infectious diseases to higher levels of the system. Community health workers are essential during this role, and they understand that the population's needs, culture, and barriers to care. At the national level, agencies such as the Center for Disease Control and Prevention and FEMA play a key role in coordination and large-scale response. CDC tracks disease outbreaks and provides evidence-based guidelines to support public health investigation, while FEMA coordinates disease relief, funding, and resource distribution across affected areas. At the global level, organizations like the WHO or World Health Organization help coordinate international responses. They also provide medical aid and support disease prevention efforts. They can assist the global disease surveillance as well to help prevent the spread of outbreaks across countries. All three levels work together through strong communication and collaboration, and information flows from local to national and then to global systems, allowing for rapid response and effective outbreak management. This coordinated approach helps reduce illness and death, but also supports recovery in the affected communities, and nurses play a vital role at every level. Ethical considerations. Ethical considerations are extremely important when providing care, especially to vulnerable populations like the Indigenous community, as they already historically have experienced health disparities and mistrust with the healthcare system. First, cultural respect is essential. Healthcare workers must acknowledge and respect cultural beliefs, traditions, and healing practices. This may include involving tribal leaders and community members in decision making, because this will help ensure care is culturally appropriate and acceptable. Building trust is also critical in this part, especially given the history of marginalization and inequities in healthcare. Health equity is also a key ethical principle. This means ensuring that all individuals have fair and equal access to healthcare, whether it be services, resources, or education, regardless of their socioeconomic status, geographic location, and their background. In disaster prevention, we serve underserved populations that are often overlooked when distributing aid and resources and make sure they're getting that equitable care. Additionally, it's important to avoid bias and provide culturally competent care. Healthcare providers must be aware of their own implicit biases and actively work to reduce them. Culturally competent care involves effective communication, respect for diversity, and adapting interventions to meet the need of specific populations. Overall, ethical care means being respectful and inclusive and committing to fairness while also advocating for specific vulnerable populations and ensuring that care is both equitable and culturally sensitive. Okay, when looking at nurses' role in disaster planning, nurses play that critical role both before and after disasters. They serve as essential members of preparedness, response, and recovery efforts within the healthcare system. Before a disaster, nurses focus on preparedness and prevention. This includes educating communities about health risks, promoting infection prevention strategies, and addressing environmental hazards. One of these could be like the standing water contributing to the mosquito-borne illness. Nurses also participate in emergency planning. This looks like assisting with disaster drills and helping identify vulnerable populations who may need additional support during these emergencies. Research shows that disaster preparedness education, as well as training and organizational support, are key factors that improve nurses' ability to respond effectively during disasters. After a disaster, nurses provide immediate and ongoing care. They perform triage, treat injuries, manage chronic illnesses, and help prevent infectious disease outbreaks in disrupted healthcare environments. Nurses also collaborate with interdisciplinary teams to coordinate resources and ensure continuity of care when systems are often overwhelmed. Public health interventions such as hygiene education, sanitation support, and vector control like mosquito prevention are essential in reducing post-disaster disease outbreaks. In addition, nurses can also help provide psychological and emotional support. They can help individuals and families cope with trauma, grief, or displacement. Their role is not only clinical, but also that supportive and community-centered, which is essential for a long-term recovery and resilience of a population. Overall, nurses are essential across all phases of disaster management. Evidence highlights that strengthening disaster preparedness through education, policy support, and interprofessional collaboration significantly improves disaster response and overall patient care. Okay, the nursing process. The nursing process can also be applied at the community level, where focus shifts from individual patient care to improving health outcomes for an entire population. The same 5 ADPI steps, assessment, diagnosis, planning, implementation, and evaluation, are used, but they're adapted to address the population health needs and disease prevention. First is assessment, where nurses collect and analyze data about the health status of a community. This includes identifying environmental risks like standing water that contributes to mosquito breeding, looking at rates of infectious disease, access to healthcare services, and social determinants of health, such as income, education, and housing. Nurses also identify vulnerable populations and health disparities that may increase risk of poor outcomes, using both the epidemiological data but also community input. Next is nursing diagnosis, where community-level data is then interpreted to identify priority health problems. Instead of focusing on one individual, nurses will identify patterns within the population, such as that increased risk of vector-borne disease transmission related to environmental conditions and limited access to preventative resources after the environmental event. These diagnoses help guide targeted public health interventions. In the planning phase, nurses collaborate with public health agencies, community organizations, and other stakeholders to design interventions. This could be mosquito control programs, health education campaigns, resource distribution like repellents or bed nets, and improving access overall for preventative care. Planning also emphasizes prevention, health equity, and reducing disparities among high-risk populations like the indigenous. Implementation is next, which involves putting these interventions into action. Nurses may lead community education sessions, distribute preventative supplies, support vaccination and screening efforts, and coordinate with local, state, and federal agencies. Collaboration is essential to ensure interventions reach underserved and high-risk populations. Finally is evaluation. This is going to look at and determine whether interventions were successful. Nurses monitor infection rates, track hospitalization data, and assess changes in the community knowledge and behavior after the intervention. Based on these outcomes, interventions are modified to improve effectiveness and to just strengthen public health, like the future of public health response. Overall, the key difference in community nursing is that the focus shifts from individual to the population and emphasizes prevention, health promotion, and equity in care delivery. And this is our references. Thank you so much for listening.